But I think as well as the money and the accountancy and the bureaucracy, we've got to do a bit better on the level of care. You know, here in the Midlands, we did have a real shock with what happened at Stafford Hospital. And you read that report, and it is heartbreaking about how elderly and frail people were treated and about how many lives were lost. So there's a big row going on today, which is about the NHS and the future of nursing, where we've said in the light of that report that nurses should spend some time when they're training, spend some time as healthcare assistants in the hospital, really making sure that they are focused on the caring and the quality and some of the quite mundane tasks, but are absolutely vital to get right in hospital. And it's going to be controversial, but in the end, the sort of health service we want is not just about making sure we've got the facts and the figures and the money and everything else spent well. It's the level of care. So when our elderly relatives go in there, we know they're going to get a really good quality of care. One of the simplest things we're doing, it's called the Friends and Family Test. Really simple idea, this. You ask people in the hospital, the staff and the patients, a very simple question. Would you be happy for your friends and your family to be treated in this hospital? And I want that to be shoved up on every ward, on the door of the hospital, because it's such a clear sign. If things start going wrong, if the staff start saying, as they did in Stafford, if the staff start saying, I wouldn't have my family treated here, you know you've got a problem. So it's a small thing, but it's a very simple thing, and if we get it in every hospital, it'll become part of the culture that we as patients will all ask, well, how does this hospital do in terms of the Friends and Family Test? Are they happy to be treated here?